Thank you for watching the fifth episode of Tap In, which is a broadcast of First Star Central Florida Academy, a national college and career preparation program for youth in foster care. This is the source for inspiration and tools on how you can jump off the sidelines and tap into creating the life that you imagine for yourself. I am Dr. Deshawn Chapman, the director of First Star Central Florida Academy. And with me today is Ms. Briana Lewis, a mental health therapist. Welcome and thank you for joining me.
Thank you so much for having me.
I just want to start by asking you to introduce yourself and just tell us what you do.
Okay. Well, my name is Briana Lewis. I am an Orlando native. I attended Florida A&M University for my bachelor's degree, and I attended UCF for graduate school. So go Knights! I'm a Knight,
Yes.
proud Knight. I currently am a licensed mental health therapist, and I own a private practice here in Orlando called Inspired Living Counseling and Consulting. I also own a mental health boutique, which promotes mental health positive merchandise and just things to kind of start conversations about mental health that sometimes are kind of seen as taboo. But I love all things mental health. I love the community in which I work. And I'm just so happy to be in the space that I'm in to be able to help others.
That is awesome. Thank you. So, what was your journey to becoming a mental health therapist? What was that like, and why did you choose that field?
Woo, well, it's funny actually. So when I initially went to college, I wanted to be a veterinarian. That was my thing. I'm be a veterinarian, and that's what I was going to do. And as I became, I think I was like maybe my sophomore year, I was like, I don't know if this is really what I want to do. So I spoke with my advisor, and we explored some other options, and it kind of, I don't know. It's funny because I've always been like the helper, the person that people kind of go to help them process different things, and it's what I've done all my life, and it kind of just felt natural to me, and I kind of progressed into that space or that field rather. But the thing with mental health or being a therapist, I should say, is that there are quite a few different routes you can take. So it really depends on initially when you go into it, you have to think about what you want your end goal to be and how the approach you want to take. I'd say that. So the route that I chose to go was becoming an LCSW. That was my end goal, if you will. So when I was in undergrad, I could have majored in psychology. I could have majored in marriage and family therapy, different things like that. The reason that I chose clinical social work is because social work looks at the system, so the person in their environment. So what about their environment or past impacts are currently affecting them right now? So the other routes, if you will, didn't explore that or really didn't incorporate that into the practice modality. So that's why I chose social work. And I'm so grateful that I did do that because I'm so flexible in what I'm able to do. So chose clinical social work of the different routes that I could take. And like I said, I got my bachelor's. And honestly, if you get a bachelor's in social work, you probably will go the route more so of like children and families and that kind of thing. I knew what I wanted to do. I knew I wanted to be a therapist. I wanted to be licensed. So I went straight into grad school. I literally graduated from FAM on a Saturday. I moved back home on Monday, started grad school. I moved back home on Sunday, started grad school on Monday. So I went straight into it. So if you have a bachelor's in social work, you can go into what's called an advanced standing program to get your master's. So it honestly knocks the first year off of the program. So I went in advanced standing because my GPA was, it met the standard and everything. So I went into advanced standing and I finished the program and I got my master's. So from there, it's a whole different journey. Again, with your MSW, you are so flexible, like so you can literally, I feel like you can do anything with MSW. You can work in the hospital, you can work in dialysis centers, nursing homes, therapy. Like it's just so flexible as far as what you want to do. So got my master's. Initially, I started out in healthcare. When I was working through my master's program, and I was actually working at a nursing home. So that gave me exposure to that population. Really didn't like geriatrics. So I was grateful for the experience because I knew that was something I can kind of cross off my list. Okay, yeah, I don't want to work in that field. So worked in geriatrics. Then I moved into the hospital, which is different roles in that way. And then as I was working, I was also pursuing my license, which is a whole other process because you have to get clinical hours and all that kind of stuff. So in addition to working, I was also working at a private practice for mental health. So I was a registered intern working towards licensure. Mm-hmm. So did all that, finished my clinical hours. Then I progressed on to taking my exam. That was a whole stressful process. Lord knows that exam was something serious. So passed my exam. Here I am. A couple years.
So we know how you got in the field. So now that you're there, what is a day on the job? What does it look like for you?
Ooh, Lordy. So, well, nowhere to start. So so for me, my specialty area or my niche is trauma. So I work within the realm of trauma. I am trained and I have a specialized treatment modalities that I use specifically for trauma. So that's my primary population. So my schedule is usually sessions back to back to back, trying to squeeze in some time for myself and work on other, ventures that I have going on. But yeah, it's just basically working within the realm of trauma. So we have, I see people that have, emotional trauma, sexual trauma, even racial trauma, and different things that have been normalized within our communities that we may not even really seem, deemed to be trauma, but it is traumatic, unfortunately. So that is my realm. A day in the life of me is just sessions back to back. Sometimes people cancel, which kind of frees up my schedule unexpectedly, which I'm sometimes grateful for. But yeah, it's just back to back sessions and just trying to balance my mental health as well, because I have to make sure that I'm okay to show up for the people that I serve and to show up for the people that I work with. So it's a lot of listening. It's a lot of talking. It's a lot of processing. It's a lot. And it can be draining, but it is so rewarding once you have that breakthrough with someone and you can actually see them doing better, they're feeling better. And that's evidenced by the way that they're living their life. So it's a lot, but you have to be passionate about it, because it can be draining and you can burn out very quickly if you don't love what you do.
Okay, so what are some things that you do to take care of yourself to make sure you're able to show up for other people?
I don't mind saying no. Honestly, I don't mind saying no. I unapologetically say no, and no without an explanation. Nope, I just don't want to, or no, I don't feel like I don't want. I just no. So that's no is often so hard to say, but it's so meaningful. And it's taken me a while to get to the place that I'm at now where I can just say no if I don't want to do something, but it's so beneficial in me preserving my peace of mind and not putting myself in situations that may be emotionally draining or just too much. I just don't feel like dealing with it. So saying no, and then traveling. I love to travel. Obviously, COVID has had a tremendous impact on that. So just trying to find local things that I can do. I love, being outside and just really connecting with nature and things like that. So just taking time for myself to really disconnect, and also making sure that I'm not my friend's therapist. Like I don't want to be the person that you always call on, because I do that all day long. So I'm sorry. Like, of course, if it's an emergency or something like that, I can help you talk through it. But just setting boundaries with my friends and my loved ones to preserve my peace of mind.
Yeah, I think that setting boundaries and being out in nature are definitely two things that our high school students can take away and apply into their lives. So let's conclude with a scripture, a quote, or an affirmation that motivates you.
So it sounds so simple, but every morning I wake up and I tell myself that I'm enough. Me saying that I'm enough, it's affirming in how I feel. Sometimes, as professionals, especially, African American professionals in these different spaces, I'm pretty sure that everyone has dealt with like imposter syndrome at some point, and just different things like that. So me telling myself every morning that I'm enough, regardless of if I had a bad day before and I feel like, well, maybe I'm not, maybe I'm not the best today. I am enough. I'm enough to do what I need to do. I'm enough to be respected. I'm enough to do my job. I'm enough to help others. So again, a very short, simple affirmation, but it's very affirming in whatever space I'm in or whatever I'm dealing with mentally.
I have to agree with you. I actually came across that same affirmation a little while ago, and I wrote it at the top of my journal, my to-do
Yep.
list actually, and it said, "I'm doing my best and I am enough." So
Absolutely. And that's all
thank
you do.
you.
Yeah, of
Thank
course.
you. I am enough. I think that's a great way to conclude our fifth session. So thank you all for watching, and thank you, Ms. Lewis, for being here with us
Absolutely.
today. Remember to visit firststar.org to connect with your program and get involved. Thanks everybody for
Thank
watching.
you.